the ICU, where we have some of the sickest and most expensive patients with a lot of expensive resources that are used to take care of those patients, having indirect or unreliable information often leads to incorrect decision making and therefore greater utilization of resources, a longer period of time on support or a longer period of time in the ICU, and therefore poorer outcomes and a longer length of stay and higher cost for taking care of these patients because you might not have the right information in the right place at the right time. It's not enough to hemodynamically support a patient and walk into the room and see that the blood pressure is 90. What we need to know is that we're getting to the appropriate blood pressure, for instance, in a physiologic way. So having direct visualization information from hTEE allows physicians to be able to get to hemodynamic stability in the most appropriate physiologic way by knowing exactly what the problem is. And so when physicians use hTEE, they very often find that they're seeing exactly what the problem is, changing the therapy and getting to the most appropriate way to hemodynamically stabilize the patient and therefore be able to wean the patient off of support faster. And this is a very important advantage of hTEE. Weaning patients off of support faster leads to decreased time on mechanical circulatory support, decreased time on a ventilator, and decreased time in the ICU. So very often we've seen, getting the patient off of pressors faster allows intensivists to get the patient out of the ICU faster. Having the capability to leave a TE probe indwelling for up to a period of 72 hours opens up new ways of managing patients' hemodynamics. One of the features of the hTEE system from ImaCor is you can bring up on the screen a split view and look directly at what the patient's heart size and function looked like an hour before, when you were changing some intervention like fluids or pressors and such, and then compare that directly with what you're seeing right now. That's very powerful to be able to wean off pressors faster. It gives a great deal of confidence. And what physicians have found is that using hTEE in direct visualization at the time that a patient's on mechanical circulatory support, for instance in the CT ICU, leaving the probe in the mid-esophageal four-chamber view and looking at the LV and the RV and the position of the interventricular septum has been very helpful in, first of all, managing the VAD patient, but in addition, being able to wean patients off of mechanical circulatory support faster. So having direct visualization information from hTEE and knowing exactly whether it's filled, whether it works, whether it's really the right ventricle and what happens over a period of time leads to better information, more robust decision making, and in many cases the ability to better manage and effectively utilize the resources that we're throwing at these patients, and therefore getting them off of support faster or getting them out of the ICU faster and better outcome and lower cost of taking care of those patients.